Hey everybody, I'm here with Lauren, and as you can see, Lauren has a bun in the oven. But I wanted to, how pregnant are you?
20 weeks.
Okay, so she's 20 weeks pregnant. What I wanted to show you was how easy it is when we work with pregnant women as chiropractors, is we have tools in our toolbox to make things comfortable. Now, it's very difficult for Lauren to get flat on her belly, but I am gonna put her face down, but I'm gonna show you how this works because this table is one of my favorite tables. First of all, short of having her try to get down on the table herself and be like a turtle and get stuck on her back, what I've already done here is I've adjusted the table so it was like this. Nice thing is I can adjust it to her height. So I'm gonna bring that down there. And then this piece here pushes away, all right? So that'll give way on her belly there. And then this piece raises. So now we have even more space for her belly. So now we're gonna have Lauren go ahead and she'll put her face in the paper. She's just gonna give a gentle push on that just to make it comfortable as she goes down. And then I just lower the table. She has to do no work. And as you can see, the dog is deciding to play again while we do this video. Okay, so if you wanna just pan in on that real quick there. And you can see now that this piece has dropped down. Is that comfortable, Lauren?
Yes.
Perfect. Now, if she needed me to, I could raise it. I could even lower that a little bit, but right there, that's gonna give her this nice clearance. So when I adjust her, this is gonna be very comfortable for her. So now the adjustment with her, what we determined with her is that we needed to, her pelvis is tipped forward. So I'm gonna use this table to bring her pelvis back. And so quite simply, I'm gonna raise this, okay? Now she's got extra weight because of her belly, so I'm gonna tighten that table down again. Just a little bit, give it a couple turns, because that way I can put pressure on that. And so all I'm gonna do, I'm gonna try to bring her pelvis this way, and I'm gonna grab a hold of her sacrum, and I'm gonna pull down, and just like that. Just like that. We're gonna do that 3 or 4 times. Good. Awesome. And then Lauren hasn't been adjusted in, how long has it been, Lauren?
Oh, it's probably been since August.
Since August, and she's new to the area, so she was looking for a chiropractor. And because she's pregnant, the nice thing about getting adjusted while you're pregnant is that this is actually gonna help to balance out her pelvis, make sure that her nervous system is sound and clear, because when there's disruption to the nervous system, that's gonna affect actually how she grows life in her belly, how her body functions with developing this baby, and then how her body heals. And in the grand scheme of things, chiropractic has actually been shown to help pregnant women have much easier pregnancies as well as much less interventions during childbirth, which is super cool. And babies tend to come out healthier as well. So I'm gonna give her one more right there. We're gonna move our way right up here. And she's kind of squishy in there, right? That's tender, isn't it? Yeah. And so when I say squishy, there's inflammation right over her spine right there. So we definitely need to adjust in there. Take a nice deep breath all the way out. Good, good, perfect. Now because she's pregnant, I did not take x-rays on her. So I'm relying on my 25 years in practice and my palpation skills to determine exactly how she needs to be adjusted. And that's when I looked here, and you can see how her hip slopes up like this. That is indicative of a forward pelvic tilt on her. So we want to bring that back, and again, that's going to help the birth canal to open up simply so she can make sure that she has a much easier birth. Just feel like I need to give one more for good measure, so yeah, so I think that was good. I also use a device that measures heat, so anytime there's disruption on the nervous system, think of those nerves, they're going to be angry and mad, and think of them as being hot, red, and swollen, which is going to change the blood flow, which changes the heat pattern. So the tool I used on her, I went up and down her spine, and it would actually tell me specific spots where her nerves are angry and mad. Come here, boy, come here. And so what we're doing as we adjust her is we're improving her body's ability to heal itself by making those nerves happy and healthy. And then in the grand scheme of things, we're gonna give her a happy and healthy pregnancy and a happy and healthy baby. And up she comes. Perfect. How was it?
Great.
Yes. Okay. Well, thank you so much. I appreciate that. And
My
looking
eyes
forward to
started watering on the table.
Of course, she also said, what did you say about this table too?
Oh, I wish I had one to sleep on.
Yeah.
So I could sleep on my stomach
I
again.
know, all pregnant women is the best. So, all right, thanks for watching. Hey, listen, if you are pregnant or you know somebody who's pregnant who is struggling with any kind of tension, stiffness, pain, but really ultimately wants to have the healthiest pregnancy possible, have them contact our office or a chiropractor in their area. And let me know what you think of this video. Drop a comment in the comments for me. Don't forget to subscribe and like this video. And once again, I always appreciate you being here, helping me grow this channel. So thanks so much, and we will see you on the next one.